We are the future. Sorry blokes, I know you have a part to play. But honestly, we're the ones that are in the home, having the kids, raising them, and we need to be well physically, mentally, emotionally, and women supporting women is such a privileged role to be in. So I do love my days at home with my kids, but I also love coming to work and helping other women. I'm Melinda Sandon, a Senior Women's Health Physio and the head of the Women's Health team here at BayMed. I finished physiotherapy 18 years ago now, and I had a great start working through a number of private and public hospitals. And then when I had my eldest child, which is nearly 15 years ago, I started to work in women's health. So for the last 8 years, I've exclusively worked in women's health and gynecological physiotherapy. So I was able to start my postgraduate training in women's health about 8 years ago, and at that time started my own professional practice at the Central Coast in New South Wales. We all had a family move, so myself and my growing kids all came back down to the Illawarra and started at BayMed in 2019. And since that time, we've seen an amazing growth in the team. So since the last 2 or 3 years, I've had a chance to continue to train up and develop some of the other physios in our team, and then take a role in managing and helping to help those guys on their journey as well. One of the things that's really unique to the work that I do is that it tends to be much more narrowly focused and specialised in what would be, I guess, akin to gynecological examination. So most of the time you are expecting that when you come in and see me. In adjunct to that, the other women on my team will be promoting and establishing how that fits within a holistic approach, but very quickly will be helped to get back into rehabilitation of their posture, the way that they move, the way that they walk, managing low back pain and hip pain with the other musculoskeletal physiotherapists in the team. Having had 4 kids of my own, I definitely know the challenges of going through 4 pregnancies and births. And also, I guess just because I'm really passionate to see people get back to doing what they love. And after potentially traumatic birth experiences, there is some confusion about like, what can I do? So I think I'm really passionate about helping women getting back to exercising. And so I think rehabilitation for women to get back to running and to get back to exercise is something I'm really passionate about. One of my career highlights has been really just a couple of weeks ago. I got to join a group of local fitness professionals. I trained with them to prepare for the Gold Coast Half Marathon, ran the half marathon and had a really fun time, but also was able to just apply some of my learning and seeing these amazing women, and many of them mums with many kids. So I'm really passionate to see women who can be active at every age and to enable them to have that opportunity. One of the things that we really try to do is be authentic. Being a mum is tough. And a recent friend of mine who is also a patient came in having had a really traumatic birth. She's already exhausted, and on the way to the clinic she's had a car accident. But what was so beautiful is to see the way that the whole team and the administrative staff, all of our physios were around her, give her a cup of tea and a chance to catch her breath, but then to receive feedback about the way that she really felt heard. The time that we can spend in the clinic, a full hour to hear your story, to really understand where you're at. It's quite different to an experience of a 15-minute in and out appointment with some medical professionals, but we can really offer the time to actually get to know you and get to provide the care that you need.